Good morning, everyone, and welcome to the public hearing. I have a preliminary statement to make. This public hearing is to discuss proposed updates to the Town of Shrewsbury's Board of Health rules and regulations for body art establishments and body art practitioners. Copies of the proposal have been made available at the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. The Town of Shrewsbury Board of Health is a 3-member board. The purpose of the board is to promote and protect the public health for the citizens of the Town of Shrewsbury. They derive their authority from the Massachusetts legislature. The members are Stephen Vigent, Jenny Fishman, and Dr. George Abraham. The City of Worcester Division of Public Health is the health agent for the Town of Shrewsbury, a member of the Central Mass Regional Public Health Alliance. The duties of a health agent are to carry out the wishes of the board, assist in the enforcement of their regulations, and deal with the day-to-day operations of the Board of Health. It is uncommon for the Board of Health to hold public hearings on proposals before them, even though all proposals are dealt with at meetings to which the public is always invited. However, because of the interest in body art, every effort has been made to provide a public forum for the exchange of ideas and views. As the purpose of this public hearing is to collect information and opinions, the board will not ask for a vote from the audience, nor will the board itself vote on the proposal at this public hearing. The board will announce the meeting date to which they will discuss and vote on the proposal. This meeting will be public. However, the board will not provide time for further public testimony unless a board member has a specific question to which an audience member can offer some clarification. After the public hearing, the board will accept written testimony for a period of 8 days until February 6, 2021. Letters can be mailed to the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. If the proposal is passed, the approved regulation will be posted at the Board of Health office and will be publicized in summary form in the Worcester Telegram and Gazette within 1 week of passage. Welcome to the Shrewsbury Board of Health public hearing to discuss a proposal to the Town of Shrewsbury's Board of Health rules and regulations for body art establishments and body art practitioners. We appreciate your taking the time to be here. A copy of the regulation is available at the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. In the interest of time, we ask that you adhere to the following ground rules. Any person wishing to make comments should sign in. Before addressing the Board of Health, you must have read the proposal. When addressing the Board of Health, you must first identify yourself by name, address, and any professional affiliation that may have impacts in your comments. Identify the section of the proposal that you wish to comment on. Please limit your comments to 2 minutes so that other members of the audience will have a chance to speak. Please be considerate of those persons speaking, whether you agree or disagree with them, and refrain from commenting out of turn. A written comment period for those who are unable to attend or do not wish to testify at the public hearing will be allowed. Written testimony will be accepted by the Board of Health until February 6, 2021. Please send comments to the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. Any person showing verbal disrespect to those speaking will be asked to leave the public hearing. And thank you for your cooperation. Okay, as a preliminary matter, this is Stephen Vigent, Chairman of the Shrewsbury Board of Health. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Jenny Fishman?
Affirmative.
Dr. George Abraham?
Yes.
Staff, when I call your name, please respond in the affirmative. Kerry Stockwell?
Affirmative.
Anticipated speakers on the agenda, please respond in the affirmative. Julie Van Arsdalen?
Affirmative.
Micah Blondeau?
Affirmative.
Cherry Tangry?
Affirmative.
Cassandra Anderson? Cassandra may not be on yet, but she may come in later. Good morning. This open meeting of the Shrewsbury Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of this meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment. For this meeting, the Shrewsbury Board of Health is convening by telephone by dialing 1-617-675-4444 and entering the following PIN number, 385-611-015 8700 # as posted on the town's website, identifying how the public may join. We are now turning to the first item on the agenda, but before we do so, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. The chair will introduce each board member or staff member who has the lead role for this particular item or guest speaker associated with this item on the agenda. After they conclude their remarks, the chair will go down the line of members first and then to staff members, inviting each by name to provide any comments or questions. I will then call upon the members to offer a motion and then for a second. Please hold until your name is called. Please remember to mute and unmute your phone by pressing *6 or mute your computer when you are not speaking so as to not trigger your camera feed or background noise. After members have spoken, the chair will afford public comment as follows. The chair will first ask members of the public who wish to speak to identify their names and addresses only. Once the chair has a list of all public commentators, I will call on each by name and afford 3 minutes for any comments. For any response, please wait until the chair yields the floor to you and state your name before speaking. If members wish to engage in colloquy with other members, please do so through the chair, taking care to identify yourself. Finally, each vote taken in this meeting will be conducted by a roll call vote. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law Chapter 20A, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Shrewsbury Board of Health will be conducted via remote participation to the greatest extent possible. To participate in the public comment portion of this public hearing, dial 1-617-675-4444 and enter the following PIN number, 385-611-015 8700 #. Please mute your device until the chair of the board addresses the agenda item and opens the meeting to public comment. This meeting is being conducted to consider amendments of the current body art regulations, Shrewsbury Board of Health rules and regulations for body art establishments and practitioners. Complete text of the proposed regulations are available in the office of the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. Please contact the Board of Health at 508-841-8384 if you would like to obtain a copy of the proposed regulations. Any person wishing to be heard should appear at the time and place designated above, or should send a letter to the Board of Health in time to be read during the hearing. Please note, individuals requiring special accommodation should contact the Health Department at 508-841-8384 at least 5 days prior to the hearing date in order to facilitate your request, and thank you. Okay, this public hearing is now called to order, and the first item on the agenda is the Shrewsbury Board of Health will be conducting a public hearing to discuss proposed amendments of the current Shrewsbury Board of Health rules and regulations for body art establishments and practitioners. Okay, at this time, are there any members of the public in this meeting, on the call, that would wish to make any comments? Okay, Carrie, as far as you know, there are no commenters?
That is correct.
Okay, are there any further comments from the board itself? Dr. Abraham?
No, Mr. Chair.
Jenny Fishman?
Not at this time.
Okay, nor do I have any further comments. Okay, given that there are no public commenters on the public hearing on the rules and regulations of body art establishments and body art practitioners, I would ask for a motion to adjourn the public hearing.
So moved.
I second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Steve Vigent? Aye. So the public hearing is now adjourned. Okay, now we move on to the regular meeting of the Board of Health, being held today, January 29th, 2021 at 8 a.m. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 20A, Section 18, and the Governor's March 15, 2020 order, imposing strict limitations on the number of people that may gather in one place, this meeting of the Shrewsbury Board of Health will be conducted via remote participation to the greatest extent possible. To participate in the public comment portion of the public hearing of this meeting, please call 1-617-675-4444 and enter the following PIN number, 385-611-015-8700, #. Please mute your device until the chair of the board addresses this agenda item or opens the meeting to public comment. So this meeting of the Shrewsbury Board of Health is now called to order. The first item on the agenda is the review and approval of minutes from the December 18th, 2020 Board of Health meeting. Have all board members had a chance to review the meeting minutes?
Yes,
Yes.
Mr. Chair, motion to approve.
I'll second that.
Okay, the motion has been made and seconded. All in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Steve Vigent, aye. So the meeting minutes from December 18th, 2020 are approved. The next item on the agenda is the introduction of Cherry Tangry, Public Health Prevention Specialist and the Tobacco Coordinator. Good morning, Cherry.
Good morning. Hi, my name is Cherry Tangry, and I am the new tobacco coordinator at Worcester Division of Public Health. I joined in December, and I will be leading all inspections and any enforcement and policy works and working with all Alliance Local Board of Health. And I also live in Shrewsbury. Nice to meet you all.
Welcome.
Well, very nice to meet you, Cherry. Perhaps we'll get a chance to meet in person someday relatively soon.
Yep.
Hopefully sometime this year.
Yes, thank you.
Well, thank you, Cherry, for that introduction. Okay, the next item on the agenda is to review and discuss the coronavirus COVID-19 update. Do we have any comments from the city of Worcester? I don't know if Julie, if you have any comments you'd like to make. Or?
Good morning. How are you?
Oh, Julie.
Karen,
Hi,
are you
it's
on?
Karen. Yes,
Oh,
but feel
perfect.
Julie, feel
Saved
free.
the day.
Julie,
No,
feel
saved the
free.
day. Go ahead.
Good morning, friends. It's Karen Clark from the Division of Public Health, Happy
Oh, hi, Karen. Good
Friday.
morning.
Good morning,
Happy Friday.
everyone.
Good morning.
So I will give you my best and latest and greatest update on all things COVID. So I'm sure that all of you have seen the news and potentially have even heard from some of the seniors in Shrewsbury about the registration process to attempt to make an appointment to get the vaccine. Obviously, we're still in phase one, but as you know, as of February 1st, vaccine is, well, folks 75 and up are eligible to receive the vaccine. The challenge is that there is a shortage right now of vaccine, especially what's being distributed locally from Mass DPH. Um, Worcester has been standing up an emergency dispensing site for the last several weeks. We started that, um, I think it was January 11th, if I'm not mistaken, which was a Monday. We stood that up for first responders for the city and also the Alliance communities, including Shrewsbury. We did that for a couple of weeks with Moderna, had a pretty good turnout. So it was for fire, police, private EMS, because the WEMS was done by UMass, dispatch, and college police officers. So that went fairly smoothly. And then we opened it up to um, home care folks, which is an enormous list if you sort of unpack all of the subsets that are in that group. And then Governor Baker sort of collapsed all of the subsets of phase one into one phase, which, created more demand and then added in 75 plus for next week. So the challenge is that there's just more demand than there is vaccine. And I think letting people know that they're eligible, um, a lot of people are anxious, especially our seniors that haven't been out in a year and they want that vaccine, but they're sort of now sort of in this wild west um, situation where everybody's competing to get these very limited vaccines. So, um, right now there's not a lot of great information to be able to give out, except that um, local public health, like what we're doing, is going to try to continue to vaccinate people. It's at a slow pace, but certainly going to continue our plans through phase three. There's also going to be hopefully information coming out today from the state around what the pharmacy's role is going to be. Currently, there's a number of pins and a map on the mass.gov website, which shows you where vaccine is going to be available. Um, so we're hoping that that will create more access points for people to be able to get the vaccine. Certainly, you've heard there's a number of mega sites that are throughout the state. I think there's 7, or there will be. Um, Worcester is also in final talks with the state and some clinical partners to be able to stand up a Worcester mega site, which will be a state asset, but nonetheless another place for folks to be able to go. We've also been doing some mobile clinics in the city. As you know, we have a number of shelters and congregate care settings. We also learned, because this has been such a complex process, that there are some buildings, for example, or some agencies that are or should be partnering with a clinical partner to be able to come in and do vaccinations on site. For example, HUD buildings should be partnering with a clinical partner to actually come in and do vaccinations on site. So it's very complicated. We're just asking people to be patient. And then as far as seniors go, I'm having difficulty myself navigating the website. Um, my hope is that as things move forward, I'm hearing Governor Baker's going to have a call center where they can step seniors through the appointment process. All the councils on aging in the state received a communication from the Massachusetts Council on Aging parent organization about sort of how to help seniors navigate this process. So So there's a lot of frustration and anxiety, but we just have to continue to try to work together and find easier ways for people to access the vaccine as it becomes available.
Karen, this is Jenny Fishman. I have a question.
Sure.
I know that on the North Shore in the Beverly area, they've already opened up to 75 and over. Actually, they started Wednesday.
They weren't supposed to start until the 1st. That's
Yeah, the
what the
Walgreens up there has already started doing appointments.
Well, they have come online. The pharmacies may be operating in a different capacity, but any
Mhm.
local emergency dispensing sites, it's February 1st. And also pharmacies obviously have a lot more buying power
Right.
than what any of us have. So I think it'll be a lot like, like flu vaccinations, like and back in the day, public health, we had lines of people getting flu shots. Now we can't even pay people to take them because we're always now in competition with the pharmacies. So our hope is, the more pharmacies that get involved, the better. It'll take some of the burden off of local public health.
Sure, sure.
Hi, Karen. This is Steve Vigent. Yeah,
Hi,
I think
Steve.
part of the issue too, I think, is that I don't think maybe the communication could be better in terms of all the various potential sources of vaccination, in
Mhm.
terms of not only the public health sources, but also as you say, the pharmacies. And I believe that wouldn't primary care physicians also be offering? I know my doctor is with Reliant Medical Group, and I believe Reliant is offering vaccine to their patients. It's things like that. In other words, there's a variety of potential sources.
Mm-hmm. Yes. So thank you for reminding me. Yes, primary care is certainly going to be an option for some folks. But to your point, there needs to be some sort of a crosswalk where it's very clear all of these different places and spaces that people might be able to get it, or at least what's kind of in the pipeline for planning. I did have a conversation with the assistant commissioner of public health for the state earlier this week, and that's is exactly what I said. I said if the communications folks could just come up with, even for us municipal folks to, and Kerry, who's answering the phone and getting thousands of phone calls. I mean, we're all getting. It's just what goes out at the top and then what we deal with on the ground is two different things, and to not have like this sort of coordinated messaging and then to understand fully what all of these options are for people has really been very difficult. It's been a very challenging week. People are frustrated. People are tired. We're trying to just get through this and to say, we're going to do the right thing by everybody. Let's get this sort of unpacked in a very comprehensive way so that we know what we're saying and it makes sense, but that we're actually offering at least some succinct, information to the people that are calling. So my hope is that the Mass DPH communications team is going to come out with something that will be able to post and just be very clear, because sending people to a website that is confusing is not a good response. We've heard loud and clear that it's very difficult to use, and I think we need something much more simpler that we can just sort of use to talk to folks to calm their fears and their anxiety.
And I guess also is the way that this is working is that the federal government supplies vaccine to the state and the state disperses it, or can organizations go directly to the federal government if they wanted to?
I don't know exactly how this works with, say, the pharmacies or the hospitals, but at least for how it's trickling down to the municipal level, what you described is accurate. It's a federal initiative that comes down to the states, and then it does get dispersed. And I know that, just to kind of give you an example of how limited the vaccine is right now. Most communities, if they're doing some kind of vaccinations, are only getting 100 doses a week. Worcester is capped at 975 right now. for Worcester and the Alliance, and it's only Pfizer. There is very, very limited Moderna to go around. It's been more highly desired because of the fact that it's more nimble and it doesn't require that ultra cold storage. But we made the commitment that we wanted to continue to vaccinate appropriate phases in the city and the Alliance communities. And we said, all right, let's partner with, St. Bees or UMass and see if they can store it for us until we need the Pfizer vaccine. But again, very complicated. Worcester's actually getting some of the most dosage every week because we have capacity. But 975 is it per week. So to sort of figure out how to distribute that, to the second largest city in New England and then 6 other communities is very challenging.
I can imagine.
A little bit.
Okay.
Yeah.
I mean, everybody is getting questions. Even Representative Hannah Kane's office is getting a bunch of questions mostly from seniors right now. So I know it's a very, very challenging situation.
For sure.
Dr. Abraham, do you have anything you would like to add? Or?
Well, thank you, Mr. Chair. No, I think Karen has sort of summed it up. We are one of the clinical partners tasked with setting up a 1,000-dose a day mass vaccination site. We are thick in the middle of logistics for that. And as Karen said, the limiting factor is availability of vaccine, the ability to distribute. So the delay in getting it up and running is literally the uncertainty of daily availability of vaccine. So our goal is to do 1,000 doses a day for 4 weeks and to ramp up to 2,000 doses a day. Thereafter, 7 days a week. It's a major undertaking, but we think we have all the logistics more or less lined up. It's just the most critical issue is vaccine supply, and that's been frustrating. So we encounter the same challenges of people calling. Everyone is anxious, or at least everybody who wants to get one is anxious to get it soon enough. Unfortunately, there isn't enough. And so it continues to be a little bit of a frustrating event, given that as a country, we are at the forefront of medicine in many respects, but in this, we seem to be behind the 8 ball in a number of different ways, which is embarrassingly so compared to many other countries in the world. But hopefully we will see a change in administration, et cetera, and a little more effort at getting vaccine out sooner and sooner. A brief word on the vaccine front. Moderna and Pfizer continue to be the major vendors. Johnson & Johnson is a single-dose vaccine, which is expected to file maybe next week or so. Its efficacy is not as good as Moderna and Pfizer, but at least the advantage is it'll be a single dose. And one of the vaccine players, Merck, pulled out of the market because their vaccine trials were essentially a dismal failure. And so their vaccine candidate has been withdrawn from the market. So we'll have one less vaccine to go with, or one less vaccine vendor, and hopefully others will pick up to do AstraZeneca, which is the Oxford vaccine, which is being distributed in many other parts of the world, has also offered to manufacture more of the Pfizer vaccine. So hopefully supply will continue to ramp up in the next few months, but it seems to be a daily it's like three-dimensional chess. It seems to be a daily frustration in different directions as we scramble and try to get things moving.
Well, thank you, Dr. Abraham, for that update. Obviously, it's a huge logistics problem, so let's hope that it can get resolved. Any other comments, questions from the board or anybody else? Okay. Very good. So let's move on to the next item, which is review and act on the report from the Central Massachusetts Regional Public Health Alliance. Micah, do you have your monthly report?
Yes, I do. Good morning. So for the last month, we did a total of 80 inspections. 37 of those were routine food inspections, and the other large portion of that were COVID-19 complaint-related inspections with about 26 of those. And a lot of those have been just social distancing and mask violations, as well as different local businesses with positive staff who didn't get reported to us properly. So that's kind of what we've been dealing with the majority of the time with the COVID complaints. When we do get a complaint, we've made it a point to go out physically and investigate, make sure that people are doing the best they can with all of the guidelines that they have to follow, and making sure that public health nurses are contacted and contact tracing has been done properly as well.
This is Steve Vigent. Does it seem like the COVID complaints are diminishing?
I think they've gone down slightly over the last month. So yes.
Well, that's good to hear. Are there any other comments, questions from the board or from the speakers?
Not at this time. Thank you for your hard work.
Yeah,
Thank you.
I was saying, just to say that hospitals haven't seen as much of a decline. There's usually about a 2-week lag between community prevalence going down and hospitals seeing a decrease in prevalence, because people tend to be sick for an extended period of time. So the hospital pressure has decreased slightly, but not significantly enough. But the community prevalence seems to be coming down. So that's optimism.
Right. Fortunately, the numbers seem to be going down in terms of the total numbers of cases and the percentage of positive cases. So that's encouraging. Okay. So if there's nothing else, let's move on to the next agenda item, which is to review our meeting schedule. So how does Friday, February 26th sound to the board members?
Works for me.
That looks all right for me.
Okay, sounds good. And at that time, would the board like to vote on the body art regulation revisions?
Absolutely.
Yes.
Okay, so let's include that as an agenda item, Kerry, for February 26th.
Duly noted.
Okay, I think that does it. So do I have a motion to adjourn?
Absolutely. Motion made, Mr. Chair.
That was great.
Sorry, just sound too joyful. But,
That was fun,
Oh,
Dr.
my God.
Abraham.
I will second that.
Okay, all in favor signify by saying aye. Dr. Abraham, Jenny Fishman,
Aye.
Steve Vigent, aye. So this meeting is now adjourned. Thank
All
you,
right.
everyone, and
Have a great
thank you for
Thank you.
everything you do. Yeah.
Thank you,
Thank
guys. Take care.
you.
Have
Bye-bye.
a great weekend.
You too,
Thank
Jenny.
you.
Bye.
Bye.
Bye.